All right. This is intimidating. We had some really impressive moderators yesterday. My colleague and fellow commissioner, Alex Zay, who I haven't even gotten to catch up with. Alex, great job. Liz Grant. To listen to Liz Grant's accent, I could listen to you read the Boston phone book. I would just be enthralled. For you students, see me later, I'll explain what a phone book is. Liz also really inspired me using a blend of the arts and sciences and use some poetry to capture some of the themes that we've been emphasizing. And I want to try and bring what I hope is an American, or will be an American classic poem, to capture some of what we learned going back to the opening reception on Friday evening on through yesterday. Jonathan hinted Trump is dumb. Howie told us numbers numb. Michael conveyed that it's a new dawn. Susanna and Giulio said, just get a prawn. Chris lamented a lack of fish. Anne seeks new fruits for her dish. Jesse was clear that drought is bad. And delaying happy hour made Nick Watts sad. So with that, I'm here till Thursday. Okay. So I want to get serious here. I want to catch us up, make sure we're all on the same page. So I'm going to start off by reading the full definition of planetary health from the Lancet Commission, because I think we only got snippets of it yesterday. So bear with me. This is from the Rockefeller Lancet report. Planetary health is the achievement of the highest attainable standard of health, well-being, and equity worldwide through judicious attention to the human systems, political, economic, and social, that shape the future of humanity and the Earth's natural systems that define the safe environmental limits within which humanity can flourish. And as Richard summarized yesterday, the shorthand was, put simply, planetary health is the health of human civilization and the state of the natural systems on which it depends. But what does that mean operationally? To answer that, I want to give you a working definition of planetary health. For me, planetary health is a field focused on improving our understanding and ability to measure the public health impacts of anthropogenic environmental change, so as to inform decision-making in the land use planning or ocean use planning, environmental conservation, and public health policy realms. This working definition is very important in that what cannot be measured cannot be managed. And as Jonathan mentioned Friday evening, our task is in many ways to allow, perhaps even to demand, that the public health consequences of natural resource management decisions be explicitly factored into those decisions at a range of scales, instead of remaining in the realm of vague and poorly quantified externalities. I think that's fundamental. So how do we do this? How do we maximize our chances of having our science move into policy and action? And that's what this next session is all about. Now, there's no silver bullet, but there is one clear lesson I want to emphasize this morning from personal experience and from the literature. The single most important thing we can do is to involve decision makers, whether they be women heads of household, communities, local agencies, national governments, involve decision makers in our research from the start, in the earliest phases of planning. Science simply has to be salient to those who are in a position to use it, and securing early buy-in is the single most critical thing we can do to increase the chances that our research will have impact. So you've got to know in advance, who's your audience? What are their needs? What do they need to know? What makes them tick? If you think that if you build it, they will come, you will likely be professionally disappointed. So this morning's presenters are each working at different scales, but they are all essentially trying to guide or alter human behavior, which is, to me, the definition of policy, whether it's policy with a big P or a small p. It's really about changing behaviors. So I guess the bottom line is, and I think this was very clear yesterday, I think we all know that the sound science is necessary, but it's far from sufficient. So I want to introduce our first speaker today. It's Dr. Josh Ginsberg, a mentor, a friend, a colleague. We were together for many years at the Wildlife Conservation Society. Actually, I first met him wandering around Hwange National Park in Zimbabwe in the early 1990s. And he's now president of the Carey Institute of Ecosystem Studies in Millbrook, New York. And Josh is an ecologist, a strategic thinker, and someone who really does think about how to move science to impact. Josh.
Thank you very much. Let's see if I can get the first slide. So I'm going to be talking today about Lyme disease and preventing Lyme disease at the county level. This is work that's led by Rick Osfeld, who's a member of the board of the Planetary Health Alliance, and Felicia Keesing. So anything that you really like about this is the result of 25 years of strategic research on ticks, tick-borne disease, and what the factors, the ecological factors that drive it, and how we apply that to trying to reduce the impact of that disease. And anything you don't like is where I misunderstood and got it wrong. So Lyme disease is the fastest growing zoonotic disease in North America. You know, in the last 15, 20 years, it has spread both geographically and even more importantly in density. Each of those is a dot for occurrence at the county level. And so what do we do about it? I think the challenge is that it's increasing. There are about 300,000 cases. It's a reportable disease, but the quality of the reporting is not perfect. There are no vaccines available. They were pulled off the market. If I had more than 6 minutes and 52 seconds, I could tell you why. But fundamentally, that's not the only problem because you've got anaplasmosis, you've got babesiosis, you've got Powassan virus. There are a number of co-infections or joint infections of ticks that then infect people. And so just getting a Lyme vaccine isn't going to solve the problem. Diagnosis is problematic, and treatment is problematic. Anyone who has had it or had a friend or a family member who's had it will know exactly what I'm talking about. And the costs are hovering around $1 billion a year, right? So what do we do, right? Well, let's kill a lot of ticks. That's a good strategy. But again, the understanding of the scale and effort one needs to make is tough. There have been studies, but they've been small scale. The replication has been poor, and they've had no controls. So they've been poorly scientific, as it were. So when Rick came to me and said, you know, there's somebody who wants to give me money, I don't know how much, to solve or at least try and solve this problem, I said, great, what it will cost? Came back a couple days later and said $8 million. And so thanks to the Stephen and Alexandra Cohen Foundation, who gave a leadership gift of $5 million and are putting another $45 million into other tick and Lyme research, we were able to launch this program. The goal is basically to change the management to develop a safe approach, an affordable approach for killing ticks at the community level or the neighborhood scale. So the policy, this is a small p policy, is how do you get communities together to start addressing their own issues? We aptly named it the Tick Project because we're out there killing ticks. I like to call it the Killing Tick Project. There are two interventions. The first intervention is to put a naturally occurring fungus, MET52, into the gardens and around the houses where we are working. I'll talk about scale in a little bit. And what's been shown in previous studies is if you do that, you kill most of the ticks. So you have a control and you have the application. And there you can see up there a tick covered in fungus. It affects all three of the major life stages that affect humans, and so that will help. The second thing to do is kill ticks directly on mice. Why mice? Well, mice and chipmunks, and we'll see, are the source of most of the transmission. Not only are there a lot more mice, but there are a lot more mice that are very, very good at giving us Lyme disease. So if a tick bites a mouse, it has that is infected, it has a 95% chance of getting Lyme disease into its system. If it bites a deer, it's a 10% chance. So mice are really, really competent hosts and transfer the disease very well. So we are going to put out boxes. In fact, we are doing that right now. The boxes have fipronil, which is the active ingredient in Frontline. The mice and the chipmunks run through to get bait treats and dose themselves with fipronil. Again, this has been done at the small garden, single household scale, and has been shown to be effective at killing ticks. The problem is that at the small scale, you can kill ticks, but it doesn't influence Lyme incidence. So we're going to work in Dutchess County where we live. This is a map of Dutchess County with the hot spots of Lyme. number of reported cases per 100 of population reported out. And this is the kinds of communities we're working: peri-urban, suburban, quarter-acre, half-acre plots. And we're working across 24 of these communities, 6 replicates for each. So 6 of the communities will receive both treatments. 6 of them will get a true control where they get both treatments, but there's nothing active in the treatments, and then 1 treatment and a placebo in each of the others. It's really the scientific gold standard for this kind of work. All right, what are we going to measure? We're going to look at tick-borne disease, number of encounters with ticks, tick abundance and infection prevalence, and we're doing it through both a web-based system, an app, cell phone texting, but these communities and the households, and we're working directly right now with about 1,400 households and another 1,800 households that are as it were, part of the variable. The covariates include participant level within those communities because we sort of want to know when we're going to hit what I would call a herd effect. How many households have to participate to make this work? And over time, over the next 5 years, we hope to answer the very simple question, does this kill enough ticks to reduce the burden of Lyme disease in these communities? We are already starting a study on non-target effects, looking at the impact particularly of spraying that much fungus into the environment. And I'll talk about that under the policy implications. So this is really small p policy. This is how you get communities together. It's the sort of Mike Bloomberg, Carl Pope, climate of hope metaphor. How do we get local communities to make change? Well, the first thing is understanding the dynamics at this scale. Right? And to do that, we have to look at all these things and then report back in a way that people understand them. Then we have to build guidelines for communities who want to adopt this process once we figure out if it works. There's the big P policy piece of this, addressing some of the big questions in conservation and management. What are the effects of landscape level fragmentation on these issues? What are the impacts of predators? I'm a predator biologist, so I care deeply about this. But what are the top-down impacts if we bring in predators that eat coyotes? Would that increase foxes? Does that reduce mice, and so on and so forth? There's an issue this month in Proceedings of the Royal Society on the dilution effect, and it's something we can argue about, but not in the minute I have left. And then also the non-target impacts of this kind of large-scale or small scale but large scale at the community level intervention, spraying something out in the environment. We've been doing our own controlled studies on our 2,000-acre research property. Good news is after a year we're not seeing any measurable non-target impacts of MET52. It seems to be focused on ticks and ticks alone. We are not at the moment studying the impact of taking so many ticks out of the environment. So that's what we're doing. The Carey Institute, for those who don't know it, we're sort of, this is the local side of it. We work around the world on these environmental issues. And it's just a pleasure to be able to address this question. I like to say this is going to do one of 2 things. If we show you can control ticks and tick-borne disease at the local scale, I think that will be a phenomenal step forward because there are a lot of people out there telling you that they can come and spray your garden and get rid of your ticks. They don't tell you it won't get rid of your Lyme disease. If we discover after spending $8 million in 5 years and working with a couple thousand households that this doesn't work, then at least we know we have to try and find other solutions at the local and the national level for this problem. Thank you very much.
Thank you, Josh. So our next speaker is a young up-and-comer. I want you guys to keep your eyes on him. I think he's going to do big things. It's Walter Willett. Walter is a professor of epidemiology and nutrition and chairman of the Department of Nutrition at the Harvard T.H. Chan School of Public Health and professor of medicine at the medical school. He's got about 1,700 publications, I think. The most cited scientist, I think, in the world. I've now heard that he's only beaten by Sigmund Freud and Karl Marx, if we count Karl Marx as a scientist. So we are really, really fortunate, as I'm sure most of you are well aware. Walter is the world's authority on the nutritional issues he's going to share with us. So, Walter, thank you.
Okay. Thank you, Stephen, and Sam, and everybody who helped bring us all together here today. I'm going to give a quick overview looking at how we examine the relationship between food in our in our diets around the world and in the United States, and also how that touches the environment, and a little bit about what we can do about that. Our goal is simple. I think everyone's thought of this in one way or another. Basically, we want to have a healthy and sustainable diet for the world's population by at least 2050, one time post, and of course beyond that. Sounds very simple, but obviously I think everyone here realizes this is one of the world's greatest challenges. Just briefly, I wanted to make the point, when we look at diet and health, we have to consider the substitution issue. This is a diagram of the diet of the United States. Basically, half carbohydrates, 80% of that, half is refined starch and sugar and potatoes, unhealthy carbohydrates, and then other good bit is red meat, and until recently, partially hydrogenated vegetable oils. So the basic point, though, is if we change one aspect of the diet, say it's fish or red meat or any other major source of calories, that means we have to change something else, because we do regulate our energy intake really quite tightly, at least within 1% of the difference between intake and expenditure over a year's period. So in our analyses, it is important to look at substitutions. If we say red meat is, or let's say butter is good for us or bad for us, it really depends on what we're comparing it to. That's the point. We've done many analyses looking recently at alternative major sources of protein in relation to health outcomes like cardiovascular disease and total mortality. This is one analysis from the Nurses' Health Study. This is about 80,000 women followed for 24 years, very briefly adjusted for everything we could think of, and looking at the relative risk of coronary heart disease with replacing poultry and other major sources for red meat. The bottom line is pretty much everything you would use to replace red meat results in lower risk of coronary heart disease. And those are 95 confidence intervals around that bar. We've looked at many other major outcomes. This is type 2 diabetes, and you can see, as we did in the previous slide, pretty much everything replacing red meat results in lower risk of type 2 diabetes. Plant proteins seem to be related to the lowest risk in these kinds of analyses. We've also looked at total mortality, and there the shape of the dose-response relationship is obviously critical, and what we see, this is men, we see the same thing in women. The National Cancer Institute AARP study found the same result. Basically, there's pretty much a linear relationship between the amount of red meat in the diet and total mortality. We've also been looking at earlier life diet, and that's turned out to be pretty interesting. This is really the first time we've been able to look prospectively at what people eat during high school and then what happens to them in later years. And this is looking at premenopausal breast cancer as a function of what our participants were eating during high school. And again, in a substitution kind of analysis, we see that legumes, nuts, poultry, replacing red meat are related to breast cancer risk when they become adults. So what we feed our children is turning out to be very important as well. We've recently done some other kind of analysis looking at this in a little bit different way, and this is looking at replacing plant proteins for red meat for various sources of calories in the diet. So in the first line, for example, we're replacing processed red meat with plant protein, and to the left of that vertical line favors the plant protein, to the right of it favors the alternative source at the top line, processed meat. And you can see, again, for pretty much everything we look at, replacing that animal source of protein by plant proteins is better, although actually poultry and fish are not too different. The difference, although statistically significant, is small. One of our postdocs, Ambika Satijas, recently looked at the data in a little bit different way. We've created a plant protein index, or a plant-based dietary index, as she's called it. And it's very simple. You get one serving, or you get 1 point for one serving a day of a plant protein source, and you get a negative point for an animal protein source, and you just add that up across the foods in our food supply. And what you can see here, the blue line is, again, pretty linear. There's no sharp cutoff that you have to be a vegan or a heavy meat eater. It's pretty much a continuous line, so it means every step in the direction of a more plant-based diet was associated with better health outcomes, in this case type 2 diabetes, but we see the same for other major health outcomes as well. Now, plant-based diet is a little bit imprecise because Coca-Cola and Dunkin' Donuts are plant foods as well, and they obviously have some different effects. So we separated the plant sources of diet, plant foods, into unhealthy and then healthy plant foods. And so not surprisingly, when you add up things like Dunkin' Donuts and Coca-Cola, the red line there, that's related to higher risk. And then the plant-based diet score, healthy plant-based diet score, the green line is, again, continuously related to risk inversely. This is one issue that's become a hot topic is butter good for us or bad for us. And we've recently conducted analysis to look at that very directly. There were really never any direct studies, so this is looking at butter fat. And again, other sources of fat are consistently related to lower risk, except for other animal sources of fat, which is basically going to be mainly red meat fat. And I think many of you have seen this kind of slide before. It's looking at greenhouse gas production for major sources of protein. And the good news, it corresponds very well with the health risks that red meat, lamb and beef are related to by far the highest source of greenhouse gas. And on the right side, mainly plant sources, although chicken are related also to lower greenhouse gas emissions, much lower. This is looking at what we do with the food we produce in the United States. And the sad thing is our food supply is incredibly dysfunctional. The blue is basically what's the grain that's used to produce ethanol. The green is fed to animals, and only 10%, the dark blue up there, is actually consumed by humans. So we don't use our grain very effectively for producing food. This is actually from our family farm in Michigan. And this is sort of a sad picture because when I grew up, there were small fields, hedgerows teeming with biodiversity. But this is not only our farm, it's the next farm and the next farm, all compiled into one massive monoculture here. So biodiversity is almost non-existent in this picture. And that really describes much of what's going on in the Midwest. So it's sad we're producing this massive amount of corn. It's bad for humans. It's obviously destructive for the environment at the same time. And just a quick word about outside the U.S. The challenges are, of course, even greater here because we're so wasteful and dysfunctional. There's a lot of room for improvement, a lot of wiggle room there to make things better. But if we look at the projections by WHO to 2045, as we all know, we're adding close to 3 billion people by that time. And those 3 billion people are almost all going to be added in South Asia and Africa, in exactly the places where nutritional challenges are already most serious and severe, which creates a much greater challenge in those areas. What to do about it, of course, would take hours to discuss, so I was just going to mention one project that we've been working on for the last 4 or 5 years with the Culinary Institute of America. This is a program called Menus of Change, and everyone's invited to it. If you you can Google that. It's going to be in June 20th to 22nd in Hyde Park, New York. And in this program, we bring together the leaders of the food service industry. As Stephen said, this is finding our partners who put many tens of millions of meals on the table every day for people in this country, and looking at their challenges and sharing what we see with them. And that actually has been, I think, a very rewarding process. They've largely bought into moving their diets, what they provide, toward what we see as a direction that will be both healthier for individuals and healthier for the planet as well. So just to summarize, A shift toward a more plant-based diet will have important health and planetary benefits. The U.S. food system, as it is remarkably dysfunctional. Efforts are needed at every step of the food system to reduce environmental footprints. You really do literally need to get down into the weeds to solve the problems crop by crop. And efforts to support population stabilization globally deserve our strong support. That's unfortunately often not part of the conversation, but I think we can't take our eye off that as part of the challenge as well. Thank you.
Thank you very much, Walter. So our next speaker is Pak Budi Wardana, fellow WWF alumnus. Budi Wardana is currently the deputy head of the government of Indonesia's National Peatland Restoration Agency for Planning and Cooperation. At WWF, before that, he was Director of Policy, Sustainability, and Transformation. He began his career in 1989 as assistant lecturer for forest products technology at the Forest Department in Gajah Mada University. He has also been a recipient of the Chevening Award, a postgraduate scholarship from the UK government, and was able to do his master's in the UK on international development policy. He and BRG are key decision makers in the future of what's remaining in Indonesia's forests and in the future health of Indonesia's people and the people beyond the region. So I'm incredibly thrilled for the effort that you've made to come so far to share your thoughts with us. Please.
Thank you, Stephens. This presentation is we have three parts to introduce what is PRG, why PRG is developed by the president, established by the president, and also opening up an opportunity for collaborations with the Harvard-led research team. Sam he's approached me during the Climate Week in New York and introduced these collaborations with me. And we are in the process of finalizing the concept note that I will take forward to the bigger audience in the ministries and agencies in Indonesia. So you already well informed by the disasters we have in 2015, the forest and land fires that kicked 2.6 million hectares, of which the peatland area, 875,000 hectares. It's really a big disaster in Indonesia because our GDP is down 0.2% in the event, and 600,000 people directly hit, and they have acute respiratory problems because of that, while the impacts of the forest and land fires hit 60 million, not only into Indonesia, but across the nations in the Southeast Asia. The cost for suppressing the fire is $197 million US, but the total loss is $16 billion US, in which the health issues of the health costs of that disasters is 150 million hectares, without counting the long-term effect of what is happening during that disaster time. So the estimate losses and damages in US dollar millions in the 8 provinces are like that. But it's, But this number, firefighting cost and also the health cost, is only one time. It's like a snapshot pictures. While after this, there's an heritage emissions, heritage problems in terms of climate, carbon emissions, and also biodiversity ecosystem services. We need to avoid these things happens again. So the president established us the PRG with this target for 5 years, 2 million hectares. We don't know yet how much is our peatlands actually, how large is our peatland actually. So we do the inventory using the satellite imagery. So this is BRG purpose. The purpose of the establishment is to accelerate restorations of degraded peatland in specific, systematic, decisive, firm, and integrated and also comprehensive. The main task is to coordinate and facilitate the restorations of 7 provinces out of the 8 provinces that hit hard during the 2015 forest and land fire. The target is to plan and implement the peatland restoration for a period of 5 years, covering 2 million hectares of degraded and burnt over peatland. And if you see the status of this peatland, in terms of land cover, the 12.9 million hectares that we have, we still have 5.3 million hectares forested. And 6.1 already converted into production area, in which 1.6 million hectares is bare land. This is the source of inherited emissions from time to time. In terms of land use, only 2.9 million hectares been declared as the protected areas, while 10.1 million hectares already declared for the production areas. So the degradation status when BRG started the task, we have burn area in 2015 around 0.9 million hectares. We don't have any exact number of this because we don't have any inventory of the peatland until today. So peat domes with canals, we have 2.8 million hectares. Intact peat, we still have 6.2. So out of these production areas, and also the protected areas, we still have 6.2 million hectares. And we have shallow pit for cultivations around 3.1 million hectares. The management status of the peatland, we have a moratorium areas. So the government, the president's really firm with the decisions. So we still have 4.4 areas of peatland declared as moratorium areas, in which you could not legally opening this area for any other purpose rather than the protections. And then protected areas, we still have 2.9 million hectares, in which 675,000 hectares of this area also burned in 2015. We have concession areas. This is production areas of 3.2 million hectares, and comprises mostly for pulp and paper plantations and also palm oil plantations. We have also community managed areas around 2.4 million hectares. So, BRG mission is to plan and design and supervise the restoration activities in all those type of management, with priority activities is to supervise the moratorium on licensing of any intact peatland, to re-wet the degraded peatland, revegetations, and also water table and pit soil moisture monitoring from time to time. So the purpose of collaborations, we also invite others, not only Harvard-led team of collaborators, to produce an online decision support tool to use for us and other ministries and agencies, so that we can assess public health and other planetary health indicators into the decisions. So to forecast his events and fire activities on seasonal and sub-seasonal timescales, to support evidence-based decisions and policies. This, we need really strong evidence-based decision basis for the decisions, because the planetary health is important for the survival of the humanity. So we also need to quantify cumulative economic costs avoided or benefit gains in the human health terms for the restoration activities that we implemented, and also the forecast outcomes of BRG policy scenarios under the consideration in terms of human health and other indicators of planetary health. So the science policy collaboration will be the first for BRG to consider human health impacts as part of policy making process. to enhance our stewardship of natural system, and we need more of these types of science policy partnership to develop strong policies to protect the natural landscape, in which our task is on the restorations of peatland and maintaining healthy peatlands throughout Indonesia. Thank you.
Thank you, Pak Budi. That is one of the most exciting opportunities I think we've seen in the Planetary Alliance. It's been a focus for many years, involving the talk you heard yesterday from Miriam Marler and her work with Ruth DeFries and other colleagues, the partnership with the team at Harvard, Mantira's work on policy at Cornell, and BRG's incredible leadership in Indonesia. So thank you. Our next speaker is equally inspiring. Robin Bronin is coming from Alaska to speak with us, and she works as a human rights attorney, and she's been researching climate-induced relocation of Alaskan Native communities since the mid-2000s. She received her PhD in December 2012 from the Resilience and Adaptation Program at the University of Alaska Fairbanks and received her law degree at the University of California at Davis. She's a senior research scientist at the University of Alaska Fairbanks Institute of Arctic Biology, and she also works as the executive director of the Alaska Institute for Justice, a nonprofit agency that is the only immigration legal service provider in Alaska and does a number of things, and is also a research and policy institute focused on climate change justice issues. She's won, and I urge you to read her full bio. She has won an incredible array of really important awards, and based on yesterday's discussions related to indigenous peoples and the social dimension of what we're talking about, I couldn't think of a better speaker for this panel, so please.
Good morning, everyone, and thank you so much for the opportunity to be here today. I'm truly honored. So, when you're thinking about what I'm about to say, this is the foundation of our work. First, adaptation is forever. Justice, equity, and human rights have to be the basis of everything that we do. The work that we're doing is transdisciplinary, and we are working at the UN level. So the work that the tribes are doing in Alaska is informing UN policy. We were working with the Obama administration, with the White House Council on Environmental Quality. We've worked with the state government, and of course, the tribes are front and center of what we're doing. And I hope all of you know what's happening in the Arctic. And if you don't, I'm hoping that you will start paying attention to what's happening in the Arctic, because it is urgent. The passion in my voice is because what is happening in the Arctic is truly alarming. So the first two maps on the top are from NOAA, and they do this every month, so I'm hoping that you will look at these every month. And the one on the left is from November of 2016. The one on the right is from February of 2017. I did not include the map of December in 2016. So 3 times this past winter, the Arctic temperature was 36 to 40 degrees Fahrenheit above normal. 3 times, and if you look at where that red hot spot was, right over Greenland. And if you look then on the lower map, the temperatures in Alaska have equally been alarming, and there was just a report that was issued 2 days ago. Our temperatures this past winter and the winter before were 6 degrees Celsius above normal. This winter, we actually had snow. For the previous 3 winters, if you can imagine, there was no snow where I live in Anchorage, Alaska. 3 winters, no snow. And so that's the framework of what we are talking about. And then there's what's happening with Arctic sea ice extent. So last year, every month except during the summer, there were monthly minimums of Arctic sea ice extent. And what was really alarming was February of last year was the lowest maximum extent of Arctic sea ice, and then 2012 was the record minimum low during the summertime. This is having a profound impact on the habitability of the communities that are along the western coast of Alaska. And what's really important to understand about this issue of relocation is that it's the combination of the slow, ongoing environmental change, which is in Alaska, it's accelerating rates of erosion, because that Arctic sea ice used to be the natural barrier. And we get hurricane-strength storms. So in Alaska, we get storms with 100-mile-per-hour winds and higher, and that Arctic sea ice used to be the protective barrier. Coupled with thawing permafrost, you're getting these situations where erosion is causing land to permanently disappear. So it's the combination of these extreme weather events and slow ongoing change that's causing these communities to choose to relocate. The federal and state government has researched this a lot, and the most recent report was done in 2009 by the U.S. Government Accountability Office. And at that time, they found that 31 Alaska Native communities were imminently threatened by flooding and erosion, and 12 of those communities were making the decision, and that's really important for this conversation. They were making the decision that the best long-term adaptation strategy for them was the relocation of their entire community. And they've actually made that decision over a decade ago, and the challenge and the reason, again, why I'm so passionate about it is none of them have yet relocated. And that's despite the intense efforts. I've participated in over 100 government meetings at the national, state, and tribal level, and none of them have yet relocated. So what is planned relocation? It's really important for me to define it because at the UN level, we talk about this a lot, what this is. So first of all, planned relocation, it's about an entire community moving, and it's got to be voluntary. And the reason why voluntary and the right to self-determination is so important is because what we know from years of research is that government-mandated relocations, and they most recently occurred in Alaska, during World War II have been horrific for the populations relocated. So in Alaska, 10% of the indigenous population died. The research done because of the infrastructure development projects that have forced relocation have caused the impoverishment of people and the fracturing of their social networks. So it's critical that this relocation process be voluntary. And then it's got to be a disaster risk reduction method. So it's not the same thing to have a relocation after people are displaced because of an extreme weather event. We've got to figure out how to relocate populations, and I don't think I'm being overly dramatic when I say Boston and Manhattan, given what's happening with sea level rise, like how we're going to relocate populations prior to them being displaced for incidents like Hurricane Sandy. And then again, how are human rights going to be protected? At the UN level, there is no human rights document that specifically addresses this issue. And so when we're talking about human rights, we're talking about, in indigenous communities, it's the right to be able to continue to subsist, it's the right to improve your livelihoods, and of course the right to self-determination. So there are three huge governance issues that we're focused on. The first one is in the United States, and the United States is not alone, there is no federal or state government agency that has the responsibility to relocate populations, not one. And that's the reason why none of the communities in Alaska have yet relocated. Nobody has the mandate or the funding. The second issue, which honestly is the more challenging and the one that we're working on with 15 Alaska Native tribes, is at what point in time should a community think that they need to relocate because they can no longer be protected in place? That is a critical question that needs to be answered. And then how can human rights be protected? So in doing this research now for the last decade, this is what I've conceived of as an adaptive governance framework where you always start with protecting people in place. And the justice part of this is if people in Lower Manhattan can be protected by the technology, then people in Alaska and the South Pacific need access to that technology to be protected in place, because we don't know how to relocate populations at all, and we certainly don't do it well. And then we've got to come up with relocation indicators. What would those indicators be from an environmental, public health, social well-being perspective? And then you've got to facilitate a relocation process. You know, one of the pieces is about funding, like where people always ask me, where's the funding going to come from? And we just need to be really more strategic about the funding that already exists when we're thinking about how we respond to extreme weather events. So these are the 15 tribes that we're working with. They're along primarily the west coast of Alaska. They're 15 of the 31 communities that were identified in that 2009 report of being imminently threatened by flooding and erosion. And they are guiding every aspect of the work that we do. And everything that I'm telling you today, I've learned from them. They have been at the front lines. They have advocated with Congress and the White House to try to get their needs met in regard to their long-term safety and protection. So the relocation governance design, so one of the challenges, federal and state legislation, the way that we define disasters does not include climate change impacts, like sea level rise and erosion. So there is no funding mechanism within the Stafford Act, is the federal legislation that governs every aspect of the way that we respond to natural disasters in the United States. Good governance. What is good governance? Obviously, I keep talking about human rights because that's the foundation, but there's got to be transparency. And with the injustices that have been part of our society and are playing out now, we've got to figure out ways of engaging with communities. And so the heart of what we're doing is social environmental monitoring. So in figuring out like how you get communities engaged, people need to understand their risk, to know that they can't be protected in place. They need to believe that the science that you all have is true and accurate, and they need to be doing that with state and federal government partners, right? They can't be doing it alone, because if adaptation is forever, we need to create dynamic governance systems that can change as climate change changes and then accelerates. And then, of course, the funding. I mean, as I mentioned, so we're looking at current government programs to see where current streams of funding can come from, and obviously we're going to need additional funding sources. So I know you all know this, but what happens in the Arctic, it doesn't remain in the Arctic. And one of the things that I just read literally 2 days ago is the governor of Louisiana just declared a state of emergency 10 days ago because of the loss of coastal lands in Louisiana, a state of emergency in Louisiana because of sea level rise. And so obviously we need to figure this out. And one of the pieces, you know, that people ask me is we want to do community-based health monitoring. I know nothing about health, and when I talk about community-based health monitoring, I mean communities empowered with gathering the information and understanding it as climate change accelerates, so they have really good information about how climate change is impacting their health. And if you have any ideas, please come up to me afterwards, because I would love to partner with you. Thank you.
Thank you very much, Robin. Very important contribution. We'll be following up. We'll have some time for question and answer. Our next speaker is another friend and colleague, another former Panda, Taylor Ricketts. Many of you know him. He is the Gund Professor and the Director of the Gund Institute for Ecological Economics at the University of Vermont, which is recently expanding its mandate, which is a sign of success. Taylor is also one of the founders of the Natural Capital Project, really one of the pioneering consortia focused on understanding and applying our ecosystem services thinking. Taylor has won innumerable awards, including being recognized by Thomson Reuters as one of the world's most cited and influential scientists, but not as highly cited as Walter, I'll just say that. So please, Taylor.
Okay, thanks, Steve. And it's a great pleasure to be here. I've watched the Planetary Health Alliance form over years, and I agree with what was said at the very beginning of this conference that it's a big weekend for all of us. So what I want to talk about is connecting watershed condition to childhood health, looking at global relationships scientifically, but also connecting it to policy in a variety of ways. I just want to start off by saying my name's up here and I'm standing here, but there are 4 people in particular that have done a lot of the work on this project, and those are from left to right: Diego Herrera, Alicia Ellis, Renaiva Rosolofsson, and Brendan Fisher. Many other authors, which you'll see at the end, but these 4 have done a lot of the work you're about to see. Okay, so this is the slide that I don't need to show at this point, but suffice it to say that nature and health are related in a variety of ways that we've seen over this conference. But importantly, that environmental burden of disease, roughly a quarter, as has been said, is not evenly distributed on Earth. And that makes connecting nature and health a public health issue, a conservation and ecosystem issue, but also an ethical and distributional one. So it's a really important thing for all those reasons. I think as scientists, this is my picture of what we need to do as scientists to connect policy to this relationship between ecosystems and health. And this is similar to several figures you've seen. This is just our version. And roughly, we need to know how policies and decisions connect to ecosystem changes, cause them, how those changes cause specific ecological effects that produce new health risk factors, and how those health risk factors connect to actual measured health outcomes through that yellow box, which is this mediating factors, right? So that's very vague. Here's an example from one of the most often talked about ones, how, say, forest policy might connect to deforestation and cause it, changing the microhabitat distribution for mosquitoes, changing the abundance of vectors and their population sizes, and causing malaria, except if you have something like bed nets or prophylactics and things, right? So linking policies through the ecosystem changes and the risk factor changes to actual measured health outcomes, taking account of these mediating factors, is, I think, kind of a snapshot of the scientific challenge we have to make our science policy and decision relevant. So I'm going to show you one example of our group working on this, trying again to specifically connect watersheds and waterborne disease. And our question is this one: how does watershed disturbance or condition affect downstream diarrheal disease among children? So diarrhea, as I'm sure many of you know, but I've learned as part of this project, is the second biggest killer of children on Earth. It kills more kids every year than measles and malaria and AIDS combined. So it's a big health outcome that's obviously related to environment. Our approach this way is a big data approach. It's not typically what we do in my group, but we're taking a sort of global multi-country approach using DHS surveys, which are these USAID-run surveys that have been going for many years in about 90 countries, hundreds of thousands of households now. And we had a grant from the National Science Foundation to compile them for the first time around linking ecosystem services and health. This is a picture of us trying to do that at SYSINC. Several people in this room were in that project, and no, I don't know why that big fish is there on the wall. That's what everybody asked me. That's a story, I'm sure, but it's just there. Here's what the data look like. So every red dot is a cluster of households, 10 to 20 households in each dot, every occupant of that household. After cleaning up all these data, we have a database of about 800,000 children in 49 countries, and we know a lot about them. We know their health outcomes, social factors, sanitation factors, all from DHS. And we've added natural features like climate variables and land use, also watershed conditions. We've drawn the watershed above every kid and asked what's the human activity and forest cover in those watersheds, right? So this is what's setting us up. Here's a picture just from one country to tell you what the data look like in a little more detail. About 2,800 households in Mozambique from the most recent survey there. And we can ask where diarrhea equals yes, right? Where a child has experienced diarrhea in the last 2 weeks, that's the variable of the outcome. Whether they have an improved or unimproved water source in that household. And then from our watershed variables, what's the degree of human activity in the watershed above that household? So these are the variables we're trying to connect in this sort of synthetic, global exploration of how nature and health are related. So how are we doing against this standard I set up? This is how we stack up against this box and arrow diagram. We have variables about upstream human activity and tree cover. We have the outcome, diarrhea itself, prevalence of diarrhea, and then we have a lot of information on these mediating factors, a lot of things we know affect diarrhea. And we're going to try to understand the relationships here. And here is the sort of one and only results slide. So I'll walk you through it. Each of those variables I just mentioned is a row here, and that red line down the middle is a no effect line. And if a symbol is to the left of that line, that factor decreases diarrhea, it improves things. If it's to the right of that line, it increases the probability of diarrhea among kids. It makes things worse. So that top 2/3 of the graph is all those socioeconomic variables that are often related to diarrhea. The two that are interest of us for this particular thing are the bottom two, showing that human activity upstream, when there's more of it, there's a higher probability of childhood diarrhea in the clusters and households, whereas higher tree cover, higher forest cover upstream causes a decrease, a measurable one across all these different countries and all these different kids on average in diarrhea, right? Some other well-known things pop up there too, that, you know, getting old helps, being wealthier helps, an educated household head helps, and so forth. Okay, so that was for all households. We split this sample, though, by urban and rural households, and this is a really interesting sort of capital swap story. You can see, again, just look at that bottom box. You can see that for rural households, the red triangles, it's the same pattern. Upstream activity helps, makes it worse. Tree cover upstream helps. But for urban kids, those signals go away. And this, to me, is evidence that the connection between health and nature is less important for urban kids, right? They're swapping natural capital as a source of human health for things like infrastructure and built capital. So let's talk a little bit about policy. I'm going to show you 3 quick ways we're thinking of that. One is we can actually get the marginal effects out of this model. So we can say, what's the effect on the change, what's the expected change in the probability of diarrhea among kids if you do various things? And so this is for the rural populations, a graph showing kind of stacking up potential interventions and their effects on diarrhea prevalence. So you can see that, you know, improving wealth or education or sanitation, those all reduce the probability of diarrhea, but also improving tree cover upstream. The more you do it, the more that also decreases the probability of diarrhea, such that even a 30% change is on par with something like improved sanitation in the household, right? So it's not the most important intervention, but it stacks up on par with at least some of the traditional ones. And again, we do that same for urban, and we can see that these natural capital interventions have no significant impact. Again, mirroring that earlier result that it's a stronger connection between nature and childhood health in rural households. Another thing we can do is work with somebody like World Wildlife Fund, which we're doing as a pilot in Kenya, and we hope in priority watersheds throughout their portfolio, to ask where are children vulnerable. Our model can be used to build an environmental vulnerability index and a social vulnerability index. Where are kids downstream of degraded watersheds, and where do they lack the sort of infrastructure to insulate them from that? And we can just use a simple kind of heuristic prioritization scheme to identify watersheds where children are vulnerable in both ways, from a degraded watershed, and they lack this infrastructure to maybe insulate them from those processes. Lastly, I just want to connect this to the Sustainable Development Goals, because we heard a lot about them yesterday. And I think, in general, nature-based interventions, natural capital, green infrastructure, can be a really good way to go after several Sustainable Development Goals at once. And this is a point that's been made before. Just mapping the project I just showed you onto the Sustainable Development Goals, I can come up with 6 that it addresses at the same time. 2 from the poverty kind of realm, 2 from the health realm, and 2 from the nature realm. So I really think in general, these sorts of relationships, understanding how nature and health interact, is a way of addressing Sustainable Development Goals in bundles at a time, which is the only way we're going to make progress on such a long list of to-do items in 15 years. Okay, quick take-homes, and then I'm done. Watershed condition affects children's health, and we can find that globally even after controlling for lots of the well-known mediating factors. The signal's strongest for the most vulnerable kids, and this is really important. I showed you how it's strongest for rural kids. I can also show you, if you'd like, later about we're finding stronger signals for the poorest households compared to the more wealthy ones. And as a result, I think nature investments can be seen as public health investments in the right places, in the right conditions, and we're working with WWF, USAID, and beginning with the UN to roll that out. So thanks to all these people and supporters, and thanks to you for listening.
can come to the microphones for questions. Taylor, I omitted, and listening to Taylor reminded me, we back in 2009, a small group of us got together with support from the Rockefeller Foundation, actually, to start to think about these relationships. And we had a program called Health and Ecosystems Analysis of Linkages with many of you in this room who were founding members, and Taylor's systems thinking was really an important part of that, and that is what evolved into the Planetary Health Alliance. And as Taylor said, it's become a real thing. So it's exciting. And Taylor, thank you for tying all those threads together. If conservation can be an effective public health preventive measure, so much the better, obviously. Okay, I'm going to take just 2 questions at a time, and after 2 questions, we're going to go to the panel. We have about 9 minutes. Let's start here, please. Please introduce yourself and let us know where you're from.
Sure. Hi, my name is Sono Aibe. I work for Pathfinder International, which is a very early member of the Planetary Health Alliance. I wanted to direct my comments to Dr. Willett. And Dr. Willett, thank you so much for showing that graph on population growth. When we talk about population stabilization, though, we need to be a little careful about not inadvertently encouraging coercive policies that relate to family size and also immigration policies. And under the United Nations Sustainable Development Goal Framework 3 and 5, we talk about universal access to sexual reproductive health and rights, including voluntary family planning. And then we also talk about women's and girls' education and economic empowerment. So I just wanted to flag that with this audience.
Thank you.
Yeah, thanks. I wish I had more time to go into that, but this really should be essentially integrated into high-quality primary care, which covers all the points that you mentioned. Thank you. It must be.
Hi, Jeff Sim from the University of Edinburgh in Scotland. Also a question for Dr. Willett. I'd like to know what the evidence is on diet and health at the other end of the wealth spectrum, so in low-income countries, many of which have a long association, close association with livestock production.
Right. It does get complicated there, and clearly there's a problem at the very low-income area in populations, especially in nutrition of young children. And in most of those very poor areas, diets are extremely high in a staple carbohydrate, which is clearly poor nutritional quality, and could benefit perhaps by some animal proteins, but possibly by additional plant proteins as well, likely by both. So I think there does need to be specific, we need to differentiate, especially between adults or children under 2 and people who are older than 2. It does seem during the pregnancy and those first 2 years of age that the nutritional requirements are extremely demanding. There's very rapid growth, and much of the world is inadequate. So in those areas, and for young children especially, animal proteins, an increase in animal proteins is probably desirable given the very poor state of nutrition at this point in time. So we need to look at these in parallel. But if we look at the total global picture and the impact in the environment, the total amount of animal protein that you need to give to children under 2 is actually a very tiny part of the total global diet. So thank you for that point. And in the project I'm working on, we've been clearly distinguishing between those contexts. We have looked at, well, one of the issues is what about pregnant women in those areas as well. And the reality is that even in the poorest areas now, but especially the urban areas, they're essentially developing the same problems that we are in the United States and Western countries. In fact, the rates of obesity and diabetes are sometimes now considerably higher than they are in the United States. So in the last couple of decades, there's not a sharp distinction between the problems of those very low-income areas and the more affluent areas. There's a lot more overlap than there was just a couple of decades ago.
Thank you, Walter. Here and here, we'll take 2 questions, and then we'll go back to the panel.
I'm Rainer Sauerborn from the University of Heidelberg in Germany, and my question goes to Taylor. You made very nimble use of the DHS to get the determinants of diarrhea. What I did not understand is how you could use DHS for evaluation of interventions. You must have used other data, because they come only every 5 or so years, and I would be surprised if you could use them for evaluation as well.
All right, hold that question, Taylor. And over here. Thank you.
My name is Edward Kutondo. I work with UNICEF in Kenya on nutrition programs. My work involves interfacing the policy, the research, and the communities. So the opportunity I've seen that the communities can really play a significant role in planetary health science, both as the part of the cause of the problem and significantly as the communities that can give us solutions. So my question will either can be answered by Taylor, Robin, or Walter. When we do research, sometimes you feel that the researchers were very clear in terms of the evidence, and it's very clear. But at community level, sometimes we feel that the communities do not really realize that this is the problem we are diagnosing and talking about. So if you could just share your experiences or thoughts on how can we actively involve the communities in understanding the problem and being part of the solution.
Great. I'm going to start with Taylor and then go to Robin.
Okay, so there were 2 questions, at least, that pertain to me. First of all, on the interventions one, so that graph about the marginal effects was just that. It was sort of using the model to estimate the marginal effects of each of those factors. So if I implied it was a sort of intervention effect, I shouldn't have spoken that way. It was essentially just the strength of the relationship among different factors in the model. So in that, sorry, I'm trying to figure out where to look. I can't figure out where you went. There you are. Right. So it's the marginal effects from the model. Right, and the point's a really important one, that DHS data are not very dense in time. It's just every 5 or 8 or 10 years, so they're sparse in that way, and they're emphatically also not panel data. So we've come up against the limits of what we can do with that data keenly a lot. Should I start on the second one too?
Or you can have Robin go and then come back?
Yeah, I think I'll stop for now.
Thank you for that question. So I actually believe that the communities do know what the issues are and also part of the solutions. They may not have the full picture. So in Alaska, they are well aware of the erosion that's happening and that they need to relocate. And they may not understand all the governance issues that I addressed. And so in the way that we're doing their work, we're starting with the communities and asking what they need. I mean, I think part of the challenges is writing those research proposals. So we have funding from NSF and NOAA, and to have community engagement at that level is really difficult because of the language you need to do to get that sort of funding. But when you get that funding, it's starting that community conversation with the issues that they've already identified, but they may not understand the full picture.
Okay, we're going to try to get at least 2 more questions in. Let's go to here.
Hi, my name is Rose Marderstek, and I'm from Tufts University. And my question is for Mr. Warana. And I was wondering, at least in the U.S., we've seen that production industries are not historically very friendly to health initiatives. And I'm wondering if you've run into, in your conservation efforts, if you've run into pushback from industry, and then how you and your group have addressed that resistance. Thank you.
Okay. Second question, then we'll take answers.
Daphne Miller, UCSF, and this is for Dr. Willett, but also for the whole panel of systems thinkers here. I totally agree with Dr. Willett. We need to get down into the weeds in order to really understand what's happening with the food system in this country and to do it in a planetary model. But there seems to be kind of this glass wall between the nutrition sciences and the agricultural sciences, where nutritionists think in terms of food groups, and the folks in agriculture who are really occupied in the field are thinking in terms of systems in the field. So my question to you is, in order to really do this in a systems way and start to look at, because we know that a carrot is not just a carrot, it depends on how it is grown, what it is grown with, all the relationships that are happening in the field, the microbiome of that soil, and so on and so forth. So how do we really start to marry these two sciences and start to ask nutrition questions that truly go back to the soil? How would you design those studies?
Okay, thank you so much. We're going to start with Pak Budi and then move to Walter, and I think that's probably all the time we're going to have for questions.
Yeah, thank you for the questions. We really have a big pushback from the industries, especially on the two front. First of all, on the moratorium, because moratorium applies not only for the new license area, but if you already have your license, but for instance, you have half of your concessions not yet open, and it happens on peatland, they could not open those areas also. So the pushback from the industry is they are not really accepted the government's moratorium in terms of this is the license that we have, and why should we could not open those area anymore. So there's a lot of push from the concessions in pulp and paper concession, and also the palm oil concessions. But we use the network of market. So we push back to them. We try to engage with NGOs that work for the market side of the commodities. And we have a lot of assistance from that. So there's a movement of non-deforestation commodities currently. It's also supported by GEF with the taking out deforestations out of commodities. So we use that platform to push back with the issues of moratorium. On the second front is on the water level management. Even if the concession areas are on peatland that are allowable for the cultivations, the government put strict regulations on maintaining the water level in maximum 40 centimeters below the peatland surface. This is not good for the palm oil industries because the growth of the oil palm is not as productive as if they have the water level below 1 meter or maybe 80 centimeters. And we use the assistance from RSPO because they also put into their criteria for the RSPO certified palm oil to take at least 40 centimeters. So it is the same standard as the government of Indonesia put for the RSPO standard. So we use that. But unfortunately, in Indonesia, less than 40% of the palm oil productions are the member of RSPO in terms of volume and in terms of areas. So we need to push this back to the Ministry of Agriculture so that the Ministry of Agriculture also take in our standard of maintaining water level at 40 centimeters for the Indonesian standard for palm oil.
Great, thank you.
So this is the approach that we use.
Thank you, Pak Budi. Walter, we're going to give you 1 minute or less to solve the food systems problem.
Right. I think what we have done, what I showed, is sort of a very high-level look at what is important, what should be emphasized and de-emphasized in our diets and ideally in our food production system as well, and that indicates areas that really deserve more detailed kind of work and research as was described for around the carrot. I think land-grant colleges like where I went to undergraduate school, Michigan State, are ideally set up for that kind of work. And for example, there they've recognized and supported by lots of our kind of data that greens are an important part of the diet, and the way they've been produced and imported from California has quite a large ecological footprint, and so they've been working on trying to reduce that and show by using high tunnel greenhouses that are not heated that you can greatly extend the growing season of greens and make them locally available, and evaluating it very carefully in terms of environmental footprints. And they've shown that there can be about 80 or 90% reduction in greenhouse gas production using life cycle analysis to produce healthy greens for most of the year in the Midwest. So that's just one example of the kinds of things that need to be done. You really do need to take the carrot and the lettuce and go crop by crop and look in great detail and optimize the production both for health and environmental impacts. But there's a lot of room possible. That's pretty clear.
Well, thank you very much to this panel. Clearly, planetary health science is one that's characterized by a great sense of urgency, and there are many important avenues to get this science used in the real world, and this has been incredibly valuable. Thank you very much.